1% of breast cancer patients are men. Jeremy Bailey is part of that 1%. Good morning, I'm Jessica Lovell and welcome to the Morning Medical Update. Jeremy Bailey knew something was wrong, but still had to fight to get his diagnosis. His determination saved his life. His story might save others. Here's Janine Kiesling.
Jeremy Bailey was his own advocate and had to fight doctors in Topeka to get answers. Even after treatment and Jeremy thought his cancer was behind him, doctors failed him again. He was losing hope until he arrived at the University of Kansas Cancer Center.
Come here, Dada. More worried, but helping with the housework. As you can see, it's still waiting to get done.
Jeremy Bailey hasn't lost his sense of humor after beating breast cancer for a second time. Jeremy says he never could have done it without the support of his 4 children, his fiance, and his refusal to believe everything was okay when he knew it wasn't.
I knew something was there. It wasn't like other lumps I had on my arms. This one here was a solid pea size, and it just stayed. It wouldn't move around.
Jeremy was just 35 in 2019 when he felt a lump.
I went to see my primary care provider, and he told me I was too young at 35 to get cancer. He said, let alone breast cancer.
But Jeremy insisted he get a mammogram immediately. Despite the image showing a lump, the radiologist said it was benign. Jeremy wasn't convinced and insisted on a biopsy. Nearly 3 weeks passed before he got his official diagnosis of breast cancer.
If you feel that the doctors are not doing something right, or they're not addressing your concern, you could only look out for yourself.
Jeremy thought his aggressive treatment, which included a double mastectomy and chemotherapy, was the end of his worries. But in 2022, during a physical before undergoing an elective surgery, an oncologist was called in when they found a swollen lymph node. Jeremy headed back to surgery.
They pulled out my good lymph node, left the cancerous ones in, and then I was told from them that there was nothing more they could do here, sent me to Kansas City.
Jeremy was told his cancer metastasized, and he wasn't optimistic about his future.
I was scared.
But the worry went away when he got to the University of Kansas Cancer Center. In fact, Jeremy's cancer hadn't metastasized. When he had his double mastectomy, surgeons in Topeka didn't remove all the tissue, and the cancer came back. Jeremy says he's never been so relieved to learn his doctors were wrong. And after meeting with his new team of doctors at the cancer center, Jeremy knew he was going to come out of this just fine.
Relief. Didn't have to worry. Care down there is tremendous.
Jeremy's story of being his own advocate and insisting on answers when he knew something was wrong has earned him a lot of attention, including 2 proclamations from the state. His story also led to the dedication of a week in October for male breast cancer awareness. Jeremy hopes his story saves lives.
Most guys are, ashamed to, I don't want to touch myself, they're ashamed of it. But don't be. Everyone has breast tissue. The faster you feel something, say something, get it checked out.
Oh, we just love this guy. So happy to have Jeremy Bailey with us this morning here in studio. How are you?
Pretty good.
Good that you could come in and be with us and here alongside surgical oncologist Dr. Jamie Wagner. She is the Division Chief of Breast Surgical Oncology at the University of Kansas Cancer Center. How good is it to see this guy?
I am so excited to see him this morning, and he is doing so well. I love it.
So, Jeremy, let's go back. It's 2019. You're 35 years old. You feel a lump. How did you find it, and what were you thinking?
I felt a lump just by taking a shower. I was like, if I get sick, I already know what this is. I found it on a Tuesday. That same week on a Saturday, I got sick, ended up in the emergency room with diagnosed with pneumonia. I asked the doctor there, I got this lump on my chest. Can you look at it? You're not here for that today, so follow up with your primary care provider in 10 days.
So you're in the shower, you feel this lump. Did you immediately go to breast cancer in your mind, the way maybe a woman would? You just knew it didn't belong there?
It just didn't belong there. And I got these little muscle masses on my arms. These move around. This one here was hard and firm.
So you're able to compare
Right.
the difference in the feeling. So you had to insist on a mammogram. Dr. Wagner, how rare is that? A lot of times it's the doctor insisting that a patient get a mammogram, and in this case, Jeremy is the one fighting for it.
Well, anytime we feel a mass in a woman's breast, if they're the normal age for women to get breast cancer and you're the right gender, 50s, 60s, 70s, we have no problems encouraging them and trying to convince them to get the mammogram. But unfortunately, we often want to think it's something else because we think of horses, not zebras. But, men can get breast cancer, as we're obviously seeing today, but also women in their 30s, 40s also get breast cancer.
People that don't hit that perfect profile that we think of. So Jeremy, you get the mammogram, you insist on the biopsy. You, as Dr. Wagner said, you had to be your own advocate, which she always says. Did you feel your family and friends were taking you seriously?
Oh, yeah.
Okay, so walk us through that, what those conversations were like.
At first, no one, we didn't want to believe that's what it was, but deep back in my mind, that spot didn't belong there. It has to be breast cancer. And just stayed on top of it.
So, Dr. Wagner, we had said earlier that male breast cancer patients, they account for about 1% of all breast cancer patients. So about how many male breast cancer patients have you seen over your career?
It is not common. I would say that I have probably seen 10 to 15 in probably the last 10, 12 years.
But a lot when you think about the 1%.
Yes, very true. I think the uniqueness, my numbers might be slightly biased because of where I practice.
Sure.
I'm fortunate to practice at an NCI designated cancer center. And male breast cancer is unique. So often once patients find that, they do seek that higher level.
So, and what you mean by that is that a lot of times somebody goes somewhere else, but then they ultimately end up here with you because you're able to provide and see and dig a little deeper into what's going on.
That's right.
And maybe find things that other places have missed.
That frequently happens.
That frequently happens. So we know male breast cancer, but compare it to breast cancer for women. What are the similarities? What are the differences?
As far as diagnosis, we talk a lot about, as I refer to it, as the personality type, which is the biology of the cancer. It is just like female breast cancer. Most commonly, we see hormone-positive breast cancer in men, which is the most common type of breast cancer in women. So there are a lot of similarities in that standpoint. The thing where it is often different is because, unfortunately, not everybody is quite as great of an advocate, or men don't automatically think this could be a breast cancer. It could be a lipoma. It could be, I pulled a muscle, right? And so that they will just let it go. So as a result, when we see a lot of male breast cancer finally diagnosed, it can be at a slightly more advanced stage.
That makes sense. Jeremy, have you done any genetic testing?
I have.
Any genetic mutations like the BRCA gene?
Everything was all negative on the genetic testing.
Why was it important that he did genetic testing, Dr. Wagner?
We see a lot of male breast cancers associated with BRCA mutations.
And is that something that is passed on?
Yes.
Could be, because we think
That's
about,
right.
I've done many stories where, daughters are getting checked and doing genetic testing because of their mother. And so how does it work on the male side? Same thing?
It's exactly the same, and that's a really important part of the conversation we have with all of our patients when they're in our clinics talking about genetic testing. Because when a woman gets breast cancer, they think, I have daughters, and can my daughter now get breast cancer? Incredibly important, and that's why we do want to identify those genetic mutations. But I also tell them you can equally pass that on to your son. And if you have a mutation, such as a BRCA mutation, they have a higher risk of breast cancer. They also have a risk of prostate cancer at a much younger age. So it is as meaningful for what we can pass down to our sons as to our daughters.
I want to repeat that. So you're saying that if a mother has this genetic mutation and they send their daughter running to get tested, they need to also get their son in as well?
That's right, because mom and dad passes genes down equally. And what you get from your mom and dad, 50-50 chance that you got the mutation or you didn't, but it does not discriminate according to gender.
Okay. So, Jeremy, you had a double mastectomy in 2019, correct?
Correct.
Then you start getting regular cancer follow-ups. Then they caught something in June of 2022. Tell us about that.
So I was in the cancer at the oncologist's office in Topeka. He was just doing a routine checkup. He felt a swollen lymph node. And he looks at me, he goes, I think it's back.
What were you thinking? Here we go again?
Just, yeah.
So what made you come to Dr. Wagner? How, were you thinking that the cancer had spread? Is that why you sought out her and her expertise? Tell us about that.
They did a needle biopsy in Topeka. They put surgical clips in and stuff. I went on August of 2022, had the lymph node removed. Instead of taking out the cancerous lymph nodes, the good ones were taken out, the bad ones were left in, and then they referred me down here to KU Cancer Center.
Okay, so good ones taken out, bad ones left in. Those are terms we can understand. Dr. Wagner, exactly what condition and what did you find when you met Jeremy?
So Jeremy had been referred to one of our medical oncologists, Dr. Priyanka Sharma, and she had already identified something's not right because I have a biopsy of a lymph node that says there's cancer there. I have 8 lymph nodes that have been removed surgically and there's no cancer there. So something was not quite right. And she very appropriately got on top of this, got an ultrasound, and we could see that there was a 5-centimeter mass still in his armpit or his axilla. So that's when Jeremy was referred to me, and I could feel this very easily in the clinic, and he really just needed to go back to surgery to have everything resected. We knew it was in his lymph nodes, so when we took him back, we needed to remove all of the lymph nodes, or what we refer to as an X-ray lymph node dissection.
So explain how that happens. You have the double mastectomy. Kind of how does that relate to the lymph nodes, and then how is it that it was still in there?
So just from basic anatomy of breast cancer, we know that the breast has a lot of lymphatic channels. It drains to, most commonly, the lymph nodes in your armpit. And that's the first drainage route that cancer is going to take. So when we do any surgical procedure, we always check lymph nodes at the first surgery. When we do a mastectomy, it's important that it is done oncologically, where all that breast tissue is removed, especially if you're not going to be getting radiation with it. And Jeremy did not have radiation at the time of his first double mastectomy. What we also identified when he presented, Dr. Sharma saw it and discussed it with me of her concern that he had significant breast tissue remaining following the mastectomy. So that was an important piece of, it's almost like getting a lumpectomy with radiation. And we know that lumpectomies need radiation, or there is a higher risk of recurrence, and that was the situation that we were now looking at.
So you brought some photos of your armpit. I want to show them, and then just tell us exactly what we're looking at here.
So this here was not so long ago, just after radiation. The skin's starting to, the doctor always said your skin's going to blister and peel. I didn't believe it, but it did.
Do we have photos of the mastectomy? Do we have those photos? If we do, pull them up, because I think they're just really interesting to show, because I think we've got something. I just think it was interesting that you were able to share. I don't know if we had you had your mastectomy by then? Yes. So because you were showing some scarred tissue, which I appreciate you sharing and being so
Right.
open to show folks kind of what you went through.
So this year's the mastectomy that Dr. Wagner did. This was a couple days afterwards.
How were you feeling, and how did you do on the recovery part of all that?
I think knowing when I had the first one to the second one, I kind of knew what to expect. So it was still painful, but
You were all in.
I was all in.
Ready
for
to
it.
get this out.
You know it.
So the sound that we love to hear, you know it, the bell.
bell.
Jeremy, this is the moment after your treatment. This is over. Just walk us through the emotions and who was there to support you.
Very happy. All my kids, my fiance Susan, was just happy to get that part done with. There's still a long road of it, but that was the everyday part. That was
The everyday part, the
Right.
daily, the treatments, exactly. I want to hear more about your advocacy, specifically those proclamations from the governor. This is a big deal. Why is it so important that you're out sharing your story?
so. Most men I come across do not know that men could get breast cancer. I've come across men where their moms had breast cancer, and I ask them, "Have you got tested?" Well, I don't need to get tested. It's women. No, it's not women. It's men too. If your mom has it, there's a chance you could have it as well.
Interesting. So yeah, because I think that's why we have you here today during this Pink Week, is to talk about the stigma and how we break that down. What other thoughts and advice do you have on that about men just putting their health first, even when it comes to their breast health?
You know, everyone has breast tissue, men, female, everyone has it. So you're more, you're just acceptable to it as a woman is when it comes to breast cancer.
Dr. Wagner, just your thoughts on that, just kind of pulling down that stigma and talking about this and having people like Jeremy out in the community sharing his story.
Yes, it's hard. Every year we do our best on our side of things to really advocate for men to know their bodies just as much as women. And that includes breast. We talk about a lot of other male breast cancers that we focus a lot on, but breast cancer needs to be in there as well. Also, I think the environment that we're trying to create when men come in, it needs to be more gender neutral.
I agree.
And I think that, I know we have intentionality about that here, making them feel comfortable in all the environments that they're in. And just being the advocate, as you hear me say all the time, is if you feel in your gut that something is not right, just have it checked out.
Follow your gut. All right, you shared a cool photo of a car with a message painted on the side. Tell us a little bit about that and who you're with in this photo.
So that is my friend Pat Washburn from Omaha, Nebraska. She goes around and spreads awareness about male breast cancer. Her husband, Marilyn, passed away from male breast cancer.
Breast cancer does not discriminate. Men too.
And it's all over the car.
That's so powerful. Who drives that? Who drives that around?
Pat Washburn.
She loves it?
Yeah, she loves it.
I love that.
Yeah, she had it all vinyl wrapped and stuff and just goes all over.
What a great connection, though, to have a woman who
know.
lost her husband to breast cancer.
Yeah.
But if found early and in getting to the right spot, how impactful is that?
Oh, that is where it, as she says, it doesn't discriminate. So we can treat male breast cancer just as well as for females.
Does it advance as quickly, or does it really operate the same inside a man or a woman?
From the biologic standpoint, it is going to behave like its female counterparts.
Interesting.
Yeah.
All right, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can tweet us or email the Medical News Network. Info is right there on your screen. Let's check in with Dr. Dana Hawkinson. Good morning. How are you?
Yeah. Hi.
Hi.
Doing pretty good. Right now, again, cases at the health system have increased. Active cases of COVID-19 have increased the last few weeks. We are hoping that increase will continue to be very slow. We haven't really seen any hospitalizations for influenza or RSV at this point in time either. And overall, hopefully, we will get back down and decrease those active infections to single digits as well.
Okay, Hawk, we've talked a lot about mRNA vaccines for COVID,
Yeah.
and we're getting a peek at future vaccines for both COVID and the flu at the same time. Moderna has published results from its phase 1 and phase 2 clinical trials. What did those results show, and how nice would it be to have that combo shot for us?
Yeah, so Moderna, again, they are looking at an mRNA combination vaccine for influenza and for SARS-CoV-2 or COVID. They have, in this vaccine, they have 4 different types of flu antigens, so 2 influenza A and 2 influenza B. And then they have a COVID spike component as well. They combined those 2 together to form one mRNA, and were able to do that trial, that phase 1 and 2. And what they found was that they are looking now for these phase 1 and 2s at safety and immunogenicity, meaning does your body react? Do you create an immune response? And what they found was that the safety was very high. It was in the same profile as what we have for our COVID vaccines. And also the immunogenicity, they saw that the antibody levels that were created with this were similar to those in the regular influenza vaccine and in their COVID vaccine as well. So that is very good news. Hopefully with this combination, that will help decrease the overall number of shots someone has to get. And this is, again, nothing new. We know we have other vaccines that are multi-component, for instance, MMR, measles, mumps, and rubella vaccine. So this is nothing new. And again, hopefully it will mean less needle injections in the future.
For sure.
Yeah.
Hawk, thanks so much. Any reporters with us today? Let's get to our community questions. Paul wants to know, what are the physical characteristics of a lipoma? versus a mass when performing a self-exam?
That's a great question.
It is.
Lipoma's tendency to be a little softer, kind of spongy.
Okay.
Whereas a breast cancer, it's more dense in its nature, and so it's going to be more firm. Both can be mobile. So that's one thing Jeremy had pointed out, that this one didn't move the same. Most of the time, breast cancers can still move around, but the consistency is just going to be much firmer.
I just love that he knows that, you know. He and women as well need to know this. And Yen has a question. You've already touched on it, but just want to make sure that people know this. Does male breast cancer patients have any high risk factors? And if it is genetically inherited in the same way as female breast cancer patients? We talked about it, just reiterate that.
So obviously, when we have a genetic mutation, that is going to be that increased risk over the average male population. Quite similar to what we experience in the female population. The risk, of course, are not as high as what we see in females. There's just, by nature, less breast tissue. But that's where we see that higher risk.
So Ruth Ellen has a question, and we talk about you always are an advocate for self-care, but also getting a second opinion. Sometimes you send people for second opinions, and sometimes you are the second opinion. She wants to know, is insurance a nightmare when it comes to getting a second opinion? Do you have to jump through a lot of hoops for stuff like that?
That's another really great question, and the vast majority of the time, it is not a problem, at least not in current day.
So don't let that be a hindrance, thinking
Absolutely
I'm going to have
not.
to be on the phone and jumping around and get the runaround.
No, absolutely not. Be your advocate. If you know, I have patients say, do I need to get a second opinion? And again, trust your gut. I mean, it's there for a reason. And if you're like, I just need some validation, that's great. Doesn't mean you have to change places. At the same time, maybe you're very confident and comfortable. A lot of people do their own research. As they tell me they've been a Google doctor before they see me, and that's great too.
But just make sure they come see you as well.
But come see us as well.
Right.
And then with the second opinion, definitely make sure that you're getting somebody that's subspecialty trained, because that is where the literature has shown, lots of studies have shown us that there's a difference in outcome, survivability, risk of recurrence when you are being taken care of by a subspecialist within oncology.
Lisa wants to know, Jeremy, do you deal with lymphedema?
Just a little bit. Not too bad. Just saw the lymphedema clinic over at the KU Health System yesterday. Just had a little bit of fluid build up, but so far everything's going good.
Explain that real quick, what that is and who suffers from that.
Yeah, we're very fortunate actually to have a lymphedema center of excellence. We're one of the few in the country that have this designation, and it is really our the fact that we are pushing forward with research, but also our methods for prevention, early detection, early intervention. And through our methods, we have been able to identify ways through early detection to get patients back down to normal 94% of the time, which is excellent. Our patients that are most risk for what lymphedema is an arm swelling that you can get as a result of lymph node removal, because with removing so many lymph nodes, there are less channels for your lymphatic fluid to get out of the arm. And as a result, it can start to build up. But it's not, the buildup like your feet swell when you're out in the hot sun all day and it goes down at night. This is much more permanent. It gets out into the soft, tissue part of your arm. And as a result, you can have higher risk of infection, pain, reduced use of your arm. And we want to keep patients going. And we can very successfully do that with a great surveillance program.
Tim has a question. Jeremy, with your advocacy, have you had a chance to meet other men who have had breast cancer or survived it? And what do you hear from them? What do you talk about?
Breast cancer treatments. How's your treatment going? How's this medicine doing?
Do they have similar experiences that you did? Maybe having to, maybe not being taken seriously. Just tell us a little bit about that.
Some have, some haven't. It just depends on, I guess, where you're at.
How helpful has it been for you to have that kind of camaraderie out in the community, knowing that you're not the only one?
Very helpful, because, hey, you got breast cancer. So I'm a guy with breast cancer. Well, when I first got diagnosed, the American Cancer Society got me in contact with people to talk to me. Well, we're women, we don't know what you're going to go through. So having that, now we can relate to what am I about to expect? What do I,
Lead the way. Share your stories. Reese wants to know, Dr. Wagner, when should men get mammograms? In what case? I mean, we know Jeremy fought for his, got his, but in what cases?
From a general screening standpoint, we do not do screening mammograms for men. That is where self-awareness, knowing your body, and if it's different, then you need to have some type of follow-up mammogram and ultrasound most commonly. We do now have recommendations per the NCCN guidelines for men starting at age of 50 that if they do have a BRCA mutation to now do screening mammograms annually, and that's a recent change.
Good.
Very good.
Very good. Just last question from Pat is, does the size of a man's breast tissue matter when being able to feel it for yourself or detect it in a mammogram? I mean, you have men that have certain types of chests, and does that matter? Does that come into account?
From an exam standpoint, I think they, if you have a good understanding of your body, then most of the time you're going to be able to feel it. As far as the imaging, sometimes getting a mammogram on certain types of body habitus can be more challenging than others. At least in my experience with our radiology crews here in breast imaging, somehow they still get it done.
They get it done.
They
I
get
like
it
that. Don't ask how, they just get it done. All right, I want to get to our takeaways today. Dr. Wagner, what's the biggest takeaway from today's talk?
Obviously advocacy, that's kind of, I think, my platform every time I'm here and we talk with our wonderful patients and their experiences. But just what Jeremy has, I think, really highlighted, that don't be ashamed. Men can get breast cancer too, and be your own advocate.
Right. Don't be
He's
afraid.
a little bit of a poster child, I think, from what I spread every
He's
year
got a
here.
mission in life. So
Yeah.
So you're up to bat on this. So Jeremy, what is the takeaway from your story? What's the mission? What do you want folks to know?
Be aware. If you feel something's not right, get it checked out. If you feel that that's not right, get a second opinion. Also, when you go into your physician's office for your yearly physical, have your physician do a breast exam. That way it's, they've done them before, let them do one. So that way you're getting checked.
That is interesting though, to have, that happens in my yearly exam. So are men to ask for this, or if they felt something, ask for it? What's the recommendation?
Yes and yes.
Yes and yes. Well, I was going to say, as a doctor, do they do that automatically for men? And should they be?
Yeah, I
Yes
mean,
and yes.
when you go to your annual exam with your primary care doctor, they really should be checking you head to toe.
Yeah.
Right? And that doesn't matter if you're a male or a female. We should be getting checked to head to toe. So
Ask.
Ask. And if they're not, ask.
Ask someone else.
Yeah.
Really, really great advice. I love this conversation. Thank you so much for sharing your story and wrapping up Pink Week with this great message today.
You're welcome.
Jeremy,
Thank you.
Thank you. Before we go, we are so excited to share the Morning Medical Update on television. A new episode airs this coming Tuesday at 9:30 on KCTV5 and at 9 a.m. on WIBW in the Topeka area. Here's a preview.
It's just pretty standard for me to say, I'd like another opinion.
He said the best thing for us to do is to sit down and talk about what do you want to do.
Tune in for Cancer, Choices, Hope, and Science.
Our episode dedicated to prostate cancer is a must-watch for anyone living with prostate cancer or at risk for the disease. And you can go online to watch our first episode. Go to kucancercenter.org/MMU. Thank you again to all of our guests and to our viewers today for being with us. We'll see you back here Monday at 8. Coming up Monday on the Morning Medical Update. She was 7 months pregnant and something didn't feel right. I'm Jessica Lovell on the next Morning Medical Update. Meet the woman who ignored doctors who said it was typical and got a second opinion that saved her life. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.